This portion of Carlos and Lisa is brought to you by Scan Health Plan.
Well, here they are again, our friends David and Holly from Scan Health Plan, a Medicare health insurance plan for people over age 65. Scan is a local, not-for-profit Medicare Advantage prescription drug plan with more than 200,000 members right here in California. They join us regularly to educate people on Medicare about the best ways to get the health insurance and prescription drug coverage they deserve. Welcome back, Holly and David.
Thanks, Carlos.
Good to see you, Carlos.
And I see we have another Scan colleague with us today.
We do. Since we'll be discussing Medicare prescription drug coverage today, we've brought along Scan's Chief Pharmacy Officer, Sharon Jhawar.
Nice to meet you, Carlos.
And nice to meet you too, Sharon. Welcome to the team. So let's jump right in. Holly, what do you want our viewers to know about the prescription drug coverage as part of their Medicare benefits?
First, let's define what Medicare Part D is. Part D is a prescription drug benefit. This federal government program subsidizes the costs of prescription drugs and prescription drug insurance premiums for Medicare beneficiaries. This coverage must be obtained through a private company.
Companies such as Scan Health Plan, right?
Yes, Scan is an MAPD plan. There are two ways for Medicare beneficiaries to access these private plans: standalone prescription drug plans or Medicare Advantage prescription drug plans. This plan is a Medicare Advantage plan that also covers Part D prescription drugs.
And the second option is what Scan offers, correct?
That's correct, Carlos.
So now that we know what it is, let's turn to our pharmacist guests and see how our Medicare viewers can get the most out of their prescription drug plan. Sharon, let's start with what you believe Medicarians should consider when signing up for their Part D benefit.
Good question. And let me start by saying it's a pleasure to be with you and your viewers, Carlos. As Medicarians shop for their prescription coverage, there are a few things I recommend focusing on. First is day one prescription coverage, meaning no deductible. There are plenty of plans that offer this, so don't settle. Secondly, are your medications covered on the formulary? And for any generics that you're on, are they offered for either a $0 or low copay? Third is hugely important if you're on insulin. Next year, there are 88 plans that will be offering insulin ranging from a $0 to $35 copay, as well as coverage in the gap. You're gonna wanna make sure you join one of these plans to save on your insulin. And lastly, have a local broker sales agent help you figure out the right medical and prescription plan that's best tailored to meet your specific needs.
I've heard that you're a proponent of medication tuneups for seniors. What are they and why should folks be sure to get them?
As we take care of our health, we routinely get our annual wellness exam, immunizations, screenings, lab tests, and we get our dental cleanings twice a year. But we rarely take the time to see if our medications are really still appropriate for us. And it's important to do so because things change with our health, our well-being, and likewise, so do the medications we need or perhaps no longer need, and hence the importance of medication tune-ups.
So please, can you give us an example of that?
Let's use medication for cholesterol as an example. Suppose I've been taking my cholesterol medication for several years now, and then 6 months ago, I decided, hey, you know what, I'm gonna really improve what I eat, and I'm gonna exercise 30 minutes every day. Now, if I stick with those changes, there's a really good chance my cholesterol medication can be either reduced or even stopped because of the lifestyle changes I've made. Other examples I tend to see is medications can be stopped or reduced in many cases for sleep as well as stomach reflux. We may need these medications at points in our life, but they're not intended or needed to be on for years in most cases. And that's why I really encourage seniors to be sure that they get a medication tune-up at least yearly. They should bring in all their prescriptions, over-the-counter medications, vitamins and supplements that they're taking, and review either with their doctor or pharmacist.
So here's a question that I think many of our viewers would like to have answered. How can seniors save money on their prescriptions?
There are 3 ways, Carlos, I always share with Scan members that I'll share with your viewers as well. We are fortunate to live in a world where there are many drugs available generically. Use them when available. If you're stable on your chronic medications, you can in many cases save by filling a 3-month supply, and it helps you stay on track with your medications, as sometimes, we miss doses here and there by refilling our medications late. And lastly, many times folks can save by filling their medications through mail order. Especially right now with the pandemic, it's a real convenience too.
Thank you, Sharon. We would love to have you back to continue this conversation about the best ways for Medicarians to get the most from their Part D drug benefits.
I would be delighted, Carlos.
That's great. Now, Holly, I know that as a Medicarian yourself, you're passionate about your baby boomer contemporaries getting all the health care benefits they're entitled to.
Yes, I am. And that's why you hear me say every time we are with you that Medicare beneficiaries or their loved ones should reach out to a local licensed insurance agent to help them pick the best plan option for coverage. Health care is local. And only a local agent who lives in your neighborhood can evaluate local plan options, local medical groups, and local hospitals, and get seniors in the right plan for their health care needs.
Absolutely, Holly. And calling those national helplines and speaking with people who don't live locally or know the local plans is risky for exactly that reason. All healthcare is local. Ask your doctor, your friends, your pharmacist, or other trusted advisors if they can direct you to one of the local agents that knows your market.
Well, once again, your SCAN team has provided us with great information for our viewers. We look forward to the next time we're with you. Until then, see you.
Thank you, Carlos.
Bye, Carlos.
Bye, Carlos.